I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we'll discuss the latest medical news, diving deep into the science, the controversies, and of course, the applications to musculoskeletal medicine. Medical news, when it's presented in the lay media, is oftentimes sensational and even, frankly, contradictory. It's hard to keep up with all the new recommendations that get thrown out. There seems to always be a story about the experts recommending some new type of health screening. It's hard to know from a 60-second snippet on the news or a quick social media headline what to make of it all. Our goal here is to critically evaluate the latest medical news in a non-biased way and present it in a format that makes it easy to understand. Thank you so much for tuning in and exploring this really exciting opportunity with us. This is such a great way for us to dive into discussions we would never have the time for in the office. Now, before we get into today's topic, let me give you a little background on me so you know where I'm coming from. I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia. I'm a medical doctor who treats painful musculoskeletal conditions. Many of these conditions are treated with minimally invasive procedures, which I do also perform. I also do non-operative care for chronic orthopedic conditions. So basically, I'm the doctor you see when your spine or your joints are bothering you, but you don't need or are not having surgery, or maybe already had a surgery and are still having problems. I've been at OSC for over 15 years, and I have been treating some of the same patients that entire time. Through the years, I have definitely seen that Ben Franklin was right. An ounce of prevention is definitely worth a pound of cure. Preventing a fracture is sure easier than treating it. In January, a systematic evidence review was released looking at screening for osteoporosis to try to prevent fractures. The U.S. Preventative Services Task Force published updated recommendations for screening for osteoporosis. This task force is an independent, volunteer panel of national experts in disease prevention and evidence-based medicine. The task force works to improve the health of people nationwide by making evidence-based recommendations about clinical preventative services. This shapes what medical societies recommend, as well as ultimately what's going to be covered by your insurance. Osteoporosis, or thin bones, is the major risk factor for fragility fractures. These fractures occur from low levels of trauma. For instance, a person falls from a standing height and breaks their hip, falls out of a chair and breaks their wrist. That would not be typical of a person with healthy or normal bone. Fragility fractures are typically of the hip and spine, but they can certainly be in other parts of the body. Osteoporosis is painless until you have a fracture, so you wouldn't know you had it unless you had a test to look for it. Nearly 1 in 5 women and 1 in 20 men over the age of 50 are affected by osteoporosis. It's a very common effect of aging. Hip fractures are associated with loss of independence and financial burdens, but much worse, they are associated with severe illness and death. The reported mortality in 1 year after sustaining a fragility hip fracture in an elderly person is estimated between 14 and 58%. 86% of hip fractures occur in people over 65. Women sustaining a hip fracture have a 5-fold increase, and men almost an 8-fold increase in relative likelihood of death within the first 3 months after a fracture. Fragility fractures are costly to the patient with increased illness, loss of independence and function, and to the medical system and the cost related to treatments. Now, obviously, we should want to prevent them, right? Okay, so how does the task force come up with its recommendations? First, they looked at the risk and benefits of screening. That's really how everything is approached in medicine and, quite frankly, in life, right? What are the risks and what are the potential benefits? All right, so let's go through the important questions. Number 1, does screening for fracture risk or osteoporosis reduce fracture or fracture-related mortality? Screening seems to reduce fractures by about 6 per 1,000 people, but there's no real change in mortality rates. Question 2, what are the harms of screening for osteoporosis? Really not much. I mean, some minor radiation and the possibility of overdiagnosis, but really not much risk here at all. Number 3, are the available screening tools predictive of increased risk for hip or major osteoporotic fracture? The data wasn't great here, but combining some screening checklists, which look for risk factors, as well as bone density scans, increase likelihood of predicting fracture. How good is DEXA scan for accurately diagnosing osteoporosis? It's very accurate. What is the effectiveness of treatment? Well, treatment with osteoporosis with bisphosphonates, like Fosmax, results in 3 fewer hip, 18 fewer spine, 28 fewer non-spine, and 10 fewer deaths per 1,000 people. Treatment with Prolia resulted in fewer hip, 44 fewer spine, 14 fewer non-spine, and 4 fewer deaths per 1,000. These numbers aren't huge, but they would be hugely impactful for the patients who were saved from the fracture, right? Based on this, the task force recommended screening women over 65 regardless of their risk factors. Younger people and men may need screening if they have other risk factors. When deciding to screen women younger than 65, they suggested a 2-step approach. Clinicians can first determine risk, and if a woman is less than 65 and is past menopause, then further screening is likely warranted. Risk factors include low body weight, a parent having had a hip fracture, smoking, excess alcohol consumption. Medications like steroids or diabetes treated with insulin may also increase risk of osteoporosis and subsequently fragility fractures. So clearly, many of the patients that I'm going to treat in pain management and orthopedics fall into these categories. The DEXA test is important for diagnosis of osteoporosis and its precursor, osteopenia, which help us intervene earlier, right? DEXA scans use very low radiation and take about 15 to 20 minutes. There's no pain. The hip and the spine are most commonly evaluated, but the lower arm can be done as well. The results will be reported as a T-score and a Z-score. The T-score shows how your bone density compares to the optimal peak bone density for your sex. The Z-score is going to show how your bone density compares to the bone densities of others who are the same age, sex, and ethnicity. First, your bone density results are compared with the results of the healthy 25 to 35-year-old adults of your same sex and ethnicity. The standard deviation is the difference between your bone density and that of a healthy young adult. The result is your T-score. Positive T-scores indicate that your bone is stronger than normal. Negative T-scores indicate that your bone is weaker than normal. A T-score of 1 to 2.5 standard deviations below normal is considered osteopenia or low bone mass. A T-score of 2.5 or more standard deviations below the young adult mean indicates the dreaded osteoporosis. Now, in general, the risk for bone fracture doubles with every standard deviation below normal. That means that a person with a bone mineral density of 1 standard deviation below normal, that means a T-score of -1, has twice the risk for bone fracture as a person with normal density. Severe osteoporosis is defined as having a bone density that is more than 2.5 standard deviations below the young adult mean, with 1 or more past fractures due to osteoporosis. If the results indicate osteopenia or thin bone, your doctor is likely to recommend adequate calcium and vitamin D, weight-bearing exercise, not to drink too much alcohol, and to not smoke. These, of course, are prevention techniques. But what if you have osteoporosis? What do you do then? All those things we just said are great, but they aren't likely to have enough effect to prevent worsening osteoporosis and fractures. So in this case, pharmacological management comes into play. Think of the options for this in 2 major groups, okay? First, the bisphosphonates. Bisphosphonates work by inhibiting the activity of osteoclasts, which are cells that break down bone tissue. By reducing osteoclast activity, the bisphosphonates help to preserve the bone mass and to prevent further bone loss. Common bisphosphonates are Fosmax, Boniva, and Reclast. The second group are more typically used with more severe osteoporosis, especially if there's been a fracture, to help build bone back. This is like Prolia or Emgality. They work on osteoblast, which build bone, and osteoclast, which break down the bone to build up bone mass. As of now, Medicare, which is the insurance coverage for most patients with osteoporosis, covers one DEXA test every 2 years for postmenopausal women over the age of 65. They'll also cover a DEXA test for a patient who's been on chronic steroids, has a disorder called primary hyperparathyroidism, or if the x-rays show a fracture or osteopenia. Now, once you see thin bones on an x-ray, it's pretty far gone, and usually these patients have significant osteoporosis anyway. Importantly, once a person receives treatment, they should continue to get DEXAs. Why, right? Well, to see if the treatment is working so that your doctor can decide if they need to change the medication or not. Now, believe me, I have seen my fair share of patients who have lifelong painful complications from fragility fractures. While the pain may improve, there's often significant biomechanical changes, particularly with spine fractures, and that leads to ongoing pain and disability. So when we can prevent these, we should. Now, should you get a fracture? We have ways to treat that, okay? Including kyphoplasty for vertebral compression fractures, but let's try to keep you away from needing it, okay? In the grand scheme of things, DEXA is easy, it's painless, it gives your doctor great information, and so I definitely recommend it for any woman over 65. Go ahead and start getting screened. Thank you so much for listening to this. I hope you found it helpful. Please come back for our next episode where we're going to explore the buzz around turmeric supplements and arthritis pain. Thank you again. Wishing you good health, and we'll see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.